Hello everyone, this is Dr. Rohit. I've secured a rank of 445 in NEET PG 2021 and this year with me is Dr. Dheeraj. Dheeraj.
Hello everyone, this is Dr. Dheeraj Anirudh. I've secured a rank of 19 this NEET PG 2021 and today Rohit and I will be playing a game of medical rapid fire in which I'll be asking him 5 questions and he'll be asking me 5 and the winner is the one who answers the more number of questions right. So are you ready for it, Rohit?
Yes, and I'll be asking the first question. This is from anesthesia and quite an easy one in that. What's the pin index for air cylinder?
Well, pin indices. It's something I really remember, but I had a hard time remembering them. So the pin index for the air cylinder must be 1.5.
Okay, then for the oxygen cylinder?
Well, the oxygen cylinder, yes, the second, 2.5.
Are you sure?
Yes, I'm very sure.
Okay, on another note, the color of nitrous oxide cylinder?
The color of the nitrous oxide cylinder. Yes. Well, that must be the blue cylinder.
Yep, you're right. Okay, next. My first question from your side.
Will I be getting 3 points for that one?
No, you'll be getting one.
Okay, well, here's your question. Name the only condition in obstetrics and gynecology in which the patient is examined with a full bladder.
Full bladder examination, that must be transvaginal sonogram. You examine with, you ask them to empty the bladder beforehand. So I guess it must be trans-abdominal examination.
So
USG trans-abdominal.
Okay. Well, you're absolutely right, but not to this question, where I've asked you about a condition in obstetrics and gynecology, not the investigation. So I'm looking for a condition in obstetrics and gynecology.
OBG condition with examined with full bladder, then something related to urine. So my guess would be urinary incontinence due to weakened pelvic floor muscles.
Well, you're absolutely right. It's stress urinary incontinence. There, you examine the patient with full bladder. Well, you get a point for that.
Okay, your second question, tough one. An anti-aging protein with a role in calcium and phosphate homeostasis.
An anti-aging protein. Well, I know of an anti-aging protein. The cetoins that are present in the red wine, they must be anti-aging. So I'll go with cetoins and red wine.
That's an answer for half of the question, but the other half regarding the calcium and phosphate homeostasis. Could you take any other guess?
Well,
You've got 10 seconds, around 10 seconds left.
Cetoins and well, no, I can only think of calmodulin or something, but again, that's not anti-aging. So
it's alpha klothoprotein, KLOTHO.
well,
Alpha klothoprotein.
Thanks for letting me know. I really didn't know this. Okay.
I'm one up over that now.
Okay, here's a question for you then. What is the gold standard investigation for evaluating cardiac left ventricular function?
Okay, I've seen this MCQ, like the same exact one, to be honest. It's either the nucleotide scanning or the cardiac MRI. I'll just take a crude guess, cardiac MRI.
Well,
not sure.
That's a really good guess, and you're absolutely right. Cardiac MRI is the right answer. You get a point for that.
Your third question coming from microbiology. Martin Lewis medium is used for which bacterium? Martin Lewis.
Okay, the culture media, they're really specific, man. So I can think of a Martin. The Thayer Martin medium that's used like very classically for Neisseria. But what's this Martin Lewis? Let's go with.
Yes, got 15 seconds, not much.
I'll go with my gut feeling. I think it's Neisseria.
Are you sure?
Yes, just log that.
Just take this over Martin.
Yeah, I think it's Neisseria.
Unfortunate for me, you got the point here. Thayer Martin as well as Martin Lewis medium are for Neisseria, but they are both different media.
Well, for me, Yeah.
Yeah,
Okay.
actually.
Okay, here's
The
a
next,
question for you. What is the nerve of Fresberg?
this is actually a direct question. It's a branch of facial nerve,
Well,
and
which
I
branch
think
of facial?
I think it is the sensory branch of
Well,
facial nerve.
yes, you're absolutely right. You're doing really well, Rohit.
This is the fourth question for you. This is based on staging called the Bishop staging. It is used for which syndrome? And if you could also elaborate the components of the staging.
Well, Steve.
Cairo Bishop.
I know of a scoring with Bishop, the Bishop score. I know the Bishop Cook surgery.
Mhm. You must be knowing this too then.
Let me go. Well, I got this one. The tumor lysis syndrome. So,
Yes, and the components you
so
could
with tumor
elaborate.
lysis, you should obviously be having uric acid and potassium and I guess calcium.
There's one more, that's phosphate. So there are four: calcium, potassium, phosphate, and uric acid.
Well, okay.
And yes, it's for tumor lysis syndrome. Good one. My
Thank
next
you.
question.
Yeah, here's your question. Which is the only long muscle that's attached to the distal end of two long bones?
Long muscle, long bones. I'll just take it. It's pertaining to our limbs. Upper limb, the biceps, triceps, they come from the scapula, glenoid, so must not be them. In extensor origin, we can think of extensor origin coming from distal end of humerus, and even the flexors come from the distal end of humerus. But they don't insert anywhere on the distal end of ulna. So one could be the brachioradialis. And coming to lower limb, uh, brachioradialis from common extensor origin. Lower limb, we have quadriceps, hamstrings, which come from the hip bone again. So we could rule out those. And the calf muscles, though they are present over the long bones, they insert into the foot or the calcaneum. So not not related to the question. I just go with brachioradialis of common extensor origin.
That's a really extensive deduction. I really don't have to say anything more, and you're absolutely right. That's brachioradialis.
Okay, last question for you. Hopefully, this one makes me win. What is the toxic dose of paracetamol or acetaminophen in an adult?
Hmm. Well, we see paracetamol everywhere. It's like the most common cause of drug poisoning, and you see it everywhere in the hospital. And I think the toxic dose must be somewhere around 10 grams, something between 10 to 15 grams of paracetamol.
Yes, you're close. It's 12 grams. I'll take it as the right answer. It's around 150 mg per kg in an adult, per kg body weight for an adult. Also, what could be the expected dose in a child? From the answer I have just told you, what could be the expected dose in a child?
In an adult, it's 150 mg per kg. Probably it's somewhere around 100 or 120 mg per kg in a child.
Yes, that would be the expected, but actually it's a little more. In a child, it comes to around 200 mg per kg, which is
Oh,
against what we usually think when it
yes.
comes to the younger age groups.
Okay.
Uh, Coming to
Okay.
my last question,
Okay,
maybe
here's
I'm
the
lucky.
last question. I have to up the level of this question. So, name the new monoclonal antibody approved for diffuse large B cell lymphoma.
DLBCL,
Yes.
monoclonal antibodies. I have no idea, so I might as well just take a guess. Is it daratumumab?
You have 10 seconds more. Do you want to fix that option?
Just daratumumab all the way. I don't have any second guesses. I
Okay.
don't know.
Well, that's not the right answer. The answer is polotuzumab that has been recently approved for the treatment of DLBL.
Polotuzumab.
Yes.
Okay, fine. So the scores tie up, I guess, right
Yeah.
now. So just in time, I have a bonus question for you. But it's from dermatology.
Hmm.
You definitely must have heard of pemphigus vulgaris and pemphigus foliaceus, right?
Yes, yes.
So what is the difference in those in among those both pertaining to the cell component against which antibodies are produced?
Hmm. The cell component. First, let me get this clear. So, yeah. So the basic clinical difference is that the mucosa is extensively involved in pemphigus vulgaris and it's paired in foliaceous. So
Okay.
the disease severity is higher in vulgaris and it's a milder course in foliaceous. But what is the cellular compartment? Cellular component. Hmm, let me take. Is it a cytokeratin? I'll go with the
Close,
cytokeratin.
close, but not close enough.
Okay.
It's actually desmoglein 3, which is responsible for the extensive mucosal involvement. Desmoglein 1 being involved in both pertaining to the skin, but desmoglein 3 is which causes antibodies against desmoglein 3 is what causes the extensive mucosal involvement.
Okay. Here's your last question for the day.
Okay.
In which condition is the beggar's procedure done?
Oh, I got lucky with this one finally. Beggars and others like Prusto, Frey procedure, and Hamburg procedure. These are all done for chronic pancreatitis.
Oh, well, you're right. And the beggar's procedure is done when the disease is restricted to the head of the pancreas. And you're absolutely right. And today, the winner for today is Dr. Rohit. Congratulations to you. It has been a really good, informative experience having this conversation with you. I've really enjoyed your company a lot.
Thank you, Dheeraj. The pleasure's been mine. Thank you, PrepLadder, for giving us this wonderful opportunity. Thank you.
Thank you.